You had vaginismus for 2.5 years.
Yes.
So from the time you were married, you realized that you were not able to have intercourse. And I remember when I saw you here and you were crying, that you thought the marriage was going to be finished.
Exactly.
Yes, I mean, it's a very upsetting thing for my patients.
Because they're going through so much.
Yes.
They kind of don't believe 100% yet that the procedure is going to work because they go through so many treatments before.
Yes.
And nothing is successful. So they want to know if it's really true, if it's really going to work, if
Yes.
they're going to be capable to have a normal life.
Yes. And I have to just say that for my average patient, it's an absolute leap of faith to travel from California, or from Portugal, or from England, or from New Zealand, or from a number of the countries that we have seen patients, to have that level of trust that this is going to work.
They have a lot of anxiety and they resist. That's what they heard from most doctors. Or maybe have something going on when you were a kid, maybe you got abused. So they don't show to them any physical help like you do. Something really efficient that...
Something that works physically. And I think waking up in the recovery room with the dilator is very, very important.
One of your patients actually told me that she asked her doctor for make a little cut on the area.
Yes.
But she mentioned that to her, say, she wake up with something inside me.
Yes.
For keep that way, the doctor said, no, that is not possible. Can't wake up with anything. And 1 week after, she get healed again. The doctor is still not able to do any examination here.
Yes.
And it's like your treatment is efficient in both areas, emotional and physically, because when the pain disappears, you have no reason to be fear anymore, to be scared, to be emotional, down.
Yes.
So the treatment helps a lot.
What we should discuss is how the dilators work. And the dilators work by stretching muscles which have for a long time been in a tightly constricted state. The observation that I've made under anesthesia is that there is always extreme tightness, what I call spasm, mostly involving the entry muscle, which is where you had the spasm, and we spoke earlier about my patients downstairs who have the spasm over there. So one theory is that there's spasm of the muscle, and because the muscles are so tight, if there is any attempted entry, it's like hitting a wall because it's so tight. The other theory that physical therapists, for the most part, believe in is that the muscles are actually foreshortened. And here the example is if a person is in a cast, and what happens after that? The person goes to physical therapy. So the physical therapy begins range of motion exercises, but you come out of the cast, you can't just straighten out your arm like this. It takes time because the muscles have been foreshortened. The muscles have gotten shorter. And so there is a parallel with vaginismus where the muscles are foreshortened, and by using the dilators, we are dilating the muscles. And so this is another important aspect of the Botox working together with the dilators. I like it when my patients continue to dilate for about a year so that they don't regress, so that they don't go backwards. And I feel that sleeping with a medium-sized dilator every 2 or 3 nights is also important. How has it been for you sleeping with the dilators?
I sleep with the medium dilator every day.
Yes.
And for me it's comfortable. The dilator become a part of you, don't bother at all.
So you have actually chosen to sleep every night with a dilator?
I choose because I don't want to regress.
You don't want to regress?
Not that I will, but I think emotional help me feel that way. I don't want to regress to the point I was before.
Yes.
And sleep with the dilator don't bother me at all. It's comfortable, and you used to do so.
The last time you were down here speaking to some of my patients, I remember you saying that the dilator is your best friend.
Oh yeah, it is.
Yeah. It's more than just putting in some Botox, more than just injecting some Botox. It is the entire program that we feel
when you
makes a lot of
you
sense.
have to be close to the dilator. Everything is
So it is the sex counseling, it's the dilators, it's the Botox, it's everything put together.
Your program is more extensive.
More extensive.
More longer. Even after the treatment, you're still in contact with your patients. You help them, you assist them, you answer questions, you support them, and you say that your patients used to teach you. You learn more and more every day with your patients, and you are grateful about that.
Yes, I have learned a great deal over the years from my patients, and I'm very grateful for that. I'm also very grateful to you for the amount of time that you've come down here and counseled my patients and spoken to them and made them comfortable. And when they leave here, they leave just with a feeling that this is something that they're going to be able to overcome.